couple of podcasts back, I had a discussion with Asker Ukendrup, and we were talking about nutrition periodization, but we did spend a bit of time talking about how laboratory data, is it's important, but sometimes it's not used appropriately. So it does come back to what you're saying is just because you've got the fancy gadgets or the fancy lab equipment, it doesn't mean, though, that is necessarily higher quality or more relevant research. And I think it's the science to practice gap here that I find interesting. So how do you bridge that gap with this? Because you've obviously illustrated there's fancy gadgets you can attach to the head all the way down to a questionnaire.
Money. What's what it comes down to? No.
It's not about the money, it's about the money.
That's right. If we've got lots of money, we put people in a sleep lab. If we've got no money, we give them a questionnaire. No, it's a little bit true. However, when we do the laboratory studies, like if it's research, take a step back. If I'm working with an athlete and I think they have a medical sleep disorder, and sleep apnea is more common than you think in normal body weight athletes, I would send them to a sleep lab to be assessed, no question. Sometimes we do research where we really want to understand the effects of an intervention, and we've done nutrition studies where we've done that. And we want them in a lab. We want it tightly controlled because we don't want all these other external variables that can influence sleep. It's very expensive to do that, which is why I talk about money. Having said that, we do these studies and sleep is actually really robust in a sleep lab. It's pretty hard to see effects in a sleep lab because sleep, as I said, is robust. And what you don't have in there are phones. You've got your diet controlled. You've got caffeine controlled. You're not drinking alcohol. You're not on your phone. You don't have your partner. You don't have screaming kids. So it's kind of artificial environment, but very controlled. So my way I'd love to do things now is if I had free world, as much money as I could spend, I would do a lab study first, and I'd do a whole lot of understanding of the real detailed stuff. Then I'll take it out to the field with wearables. And I'd say, okay, if we think this nutrition intervention might be beneficial in a lab, let's do it for 4 weeks. And you just wear your wearable in the real world and let's sort of see what happens there. But yeah, it absolutely depends on, and I use questionnaires as well with teams if they don't have resources and we just want to get a bit of an idea. Is there, any team of 30, I think there's probably 10 that would need a reasonable amount of help, and you can find those and you can work through with that. So you don't always have to have the whiz-bang gadgets, but I think it's a bit of a sort of step-down approach depending on who you're working with, what they'll do. Hard to get an elite athlete in a sleep lab, I can tell you.